50 pages, so single typed. So it's rather comprehensive, but we're just going to hit some highlights. And also the Washoe County School District and Washoe County Health District work together to create a school response plan. And Southern Nevada Health District really liked the plan that Washoe had prepared. So some of the things are quite similar in both plans. So basically, what is this plan for? It provides public health requirements, recommendations, and considerations for reopening schools. And that's all of our goals, get our schools back open. All considerations in conjunction with local, state, and federal laws and recommendations from state and federal governments. So they really looked at this plan comprehensively. The goal of the plan includes prevention of the spread of COVID-19, early detection, isolation, diagnosis, treatment, and disinfection. And the plan is open-ended, since there will be new scientific information developments and the plan will be updated periodically. The Washoe County plan has been updated 8 or 9 times, and we anticipate the same will occur with the plan for Clark County. Okay. So one of the main things we're looking at and is occurring in the schools is that parents and caregivers should strongly be encouraged to monitor their children for signs of illness every day and not send them to school in person if ill. I know from our schools in Washoe, some have been coming to school ill. This is not new to us because this has been what we've been seeing all along for years. Post signage at entrances listing symptoms. We do see signage in our schools for masks are required and to stop at the desk for temperature taking, but I haven't yet seen signage listing symptoms. And that if you have the list like that, it should say do not enter if these symptoms are present, but call the school. Staff and parents should conduct symptom screening daily and provide periodic reminders. I know that those of us that work with SESS, we have to complete a questionnaire daily. The Dorals are doing the very same. The Somersets, it's more of an honor system, but they do have their list for students and staff. Temperature screenings of students at school is not recommended, but I do see it happening. For instance, one of the schools I was at yesterday had an automatic temperature reading, a thermal scanner, and it read that my temperature was 108, and it was because I was holding a Starbucks coffee. Warning, warning. Consider a designated area for symptomatic students waiting for pickup. Some of the schools have had designated areas they could put students, many have not. One of the suggestions we would have if your school does not have another space is that we have, whether it's a TA, a clerk, trained to give medications, basic first aid, and they would respond to the classroom so that those students do not have to come to the health office. It could even be the FASA who does that, and then have that other backup person in the room with the students who are ill. Encourage parents to notify the school why the student was kept home that day. Sometimes we're going to have to call the parent. The student isn't here, the parent didn't notify the school. We really need the parents to notify us because that student could come to school the next day when he had symptoms the day before. So you see the problem. Students with minor symptoms can be observed in the health office for 10 to 15 minutes. This is recommended. that we keep an eye on them. Maybe they need water, maybe they need to use the restroom, whatever. But if the symptoms don't resolve, then we're going to follow the COVID protocols. A healthcare provider can provide a letter explaining a specific health condition and exact symptoms exhibited for the student for them to be exempted from going home. For instance, an allergy. Reassure staff and parents that exclusion from school premises is for the safety and wellness of the students, staff, and community. We're not being mean. We're just trying to follow the protocols. And these protocols are coming from our health districts. Okay. Next slide. Didn't move yet. There we go. So physical distancing is really one of the important mitigation tools we have. We want to train the staff and students to follow the 6-foot rule indoors and outdoors. Post signage again, avoid and limit visitors and volunteers in the building. Outside organizations should follow all health and safety policies of the school. Avoid congregating of students and staff. Open as many supervised routes of entry and exit as possible. Use floor markers to designate distancing, and I do see those. Elementary schools, keep the students in one classroom, and in middle and high school, maintain at least 6 feet of different distancing or barriers between students, and utilize stable classrooms whenever possible. I know that's hard. Teacher and staff maintain a minimum of 6-foot distancing, stable seating arrangements for students, avoid high-touch supplies and surfaces like electronics and art supplies, keep student belongings separate, and increase room ventilation, increase ventilation rates, and use high-efficiency filters in your HVAC system. And use alternative spaces for instruction, such as outdoors, cafeteria, or the gym. So when we're looking at what are we going to do for our students and our staff, we are concerned about an individual who has close contact with a person with positive COVID test or a person with symptoms. We're treating basically the person with symptoms of COVID as if they have had a positive test. It's the same protocol. If you have a positive test or positive symptoms, again, the same. Caretaker of somebody with a positive COVID-19 test is close contact. One of the things that can happen though with a caretaker is that once the person who has COVID or the symptoms, once their symptoms resolve in 10 days, that doesn't mean the caretaker, it's over for them. They have to stay out and quarantine 14 days from their last contact with that individual. So that means if the person who's ill or has symptoms was home 10 days, they can now go out. But for the caretaker, their 14 days starts at that time. So they would be out 24 days. And then when you're looking at all the symptoms of COVID, one of the things we worry about is if somebody has severe symptoms, such as trouble breathing, pain or pressure in the chest, new confusion, inability to wake or stay awake, and color change, bluish lips, or blueness or paleness to their face. That is always a 911 call. Okay. So this is a algorithm that was put together by our health district And it looks busy, but it's not. If you look at it and these are your symptoms, or you were exposed, or you have a positive test, you follow the arrows for what you need to do. Okay, go ahead to the next one. So during the reopening of our schools, and we are partially open now, we do have staff on our campuses, and we have had some exposures, but the schools have done such a good job in following the recommendations. So this is another algorithm. You'll see on the left in the pink box that it has all the symptoms that we're concerned about. It is not an inclusive list, but it is most of them. And then you look, well, what do I do? You need to notify the school or your supervisor, and they're probably going to ask you, in fact, we know they're going to ask you, who are you in contact with? And we just follow the arrows, and we have one part right there in the middle, the first diamond in the middle. You're going to notify the school nurse and the COVID team. We're going to talk about that in a little bit as a suggestion for the schools. Okay, we can go on next. And then we have a separate one, but it's similar in some ways for students, because COVID is COVID. And a student with symptoms of COVID shouldn't be sent to the health office alone. It's ideal if the teacher would notify the health office that sending a student down, but they should be accompanied, or we can come and get the student, better yet. And then it follows what we need to do. And we're going to always be recommending medical care for that student, as well as testing. Okay, go on. So School Health Services is a quick reference guide that can be kept in the health office, but it could also be kept in the administrator's office, in the office manager's office. And it, again, lists all the signs and symptoms. It also lists what to do if it's an emergency, what types of signs and symptoms in emergency that we just saw. And then for students, children can have what we call multi-system inflammatory syndrome. And you've probably heard about this in the news. It's rare, but it's critical and can be fatal. So again, that would be a 911 call. Okay. Okay, and now Becky is going to start. I'll move out of the way, put my mask on.
Okay. So Donna went over what the actual plan was that the health district came up with, and what I wanted to go over with you is what us as a team has put together with Donna and Tony and I in order to make the plan usable on our campuses. You know, we've tried to develop a plan and make it functional, you know, because we know it's complex and it's changing. The first thing that we have here is just a letter that can go home to parents. You know, it's been stated over and over, just notify your families to monitor these symptoms, the cough, shortness of breath, fever, you know, the whole list of symptoms, to make sure that they're not sending their students to the school with any of these. It talks about what we're doing in the classroom, that there may be some more first aid performed in the classroom to prevent the exposure to COVID, since those students will be in the health office. Just different things that they'll see in the health office as well. Of course, they'll be wearing masks all the time, and that your students are going to be sent home if they have any of these symptoms, and will require either a physician's note if it's not COVID and a positive COVID test. So our next one. All of these forms that I'm going over are actually located in SharePoint, which all of the nurses have access to. We can also give access to Nancy as well for the G Drive, but they are all available right now in the nurses' SharePoint. This next one is a teacher's guide for sending students to the health office. You know, we're always talking about decreasing the number of students that are out of class and sent to the health office. And this year in particular, we just wanted the teachers to have a little extra guide on what they can perform in their classrooms versus what they need to send students to the health office for. And that's all based on, once again, exposure, you know, and limiting students' access to being exposed. And then if they are sending them, we want them to notify the health office first, you know, just to make sure that the appropriate PPE is being worn and that we know what we're receiving as far as a student goes. All right. If you do have a parent that has screened their student at home, this is actually the triage. So if they have sent a student to the health office, there is a screener in there which you can go over to look at all of the symptoms, and you can just mark down exactly, you know, what symptoms are available or happened. I'm on the wrong page. And that would be available in the health office for them. The next one is actually, you can train all of your different staff over the phone to answer this triage form. So if a parent has gone ahead and, you know, discovered their child has symptoms at home, they call the school, this form can be completed over the phone. There's a script on the end of it that tells you exactly what to do. If they have any symptoms, you go over the script where it talks about the fact you need to stay home and that you'll require, you know, either a negative test or a re-entry plan is basically, but it's all written out and you can use the dialogue in the form. All right. As far as, I'm all out of order on mine. So this is the illness report log. And what we were asking is that it be kept by office managers and a health office, and that the lists are synchronized together, that you're working well together to keep a comprehensive list of both teachers and students that have symptoms. Now we know it can be touchy to have the nurse who's an employee to also have the teachers listed that have symptoms and are being excluded. So we know that some schools may choose to just have the office managers keep those, but we definitely want the nurses and the health offices to keep track of this report log. It lists, you know, all of the different dates that they can return, and it just keeps it all in one place. It has most of the questions that the health district will ask. Since I'm out of order, I'll look and see what's next. When you do have a student that comes in and presents with symptoms, we will be using this form that can go home with the student. It just lists exactly why you're sending them home. And then the second part of it lists how long they will need to stay home and what criteria they need to meet to return back to campus. So the second page, the parent would have to complete and sign and return to school prior to the return. The health district is asking that there be one point of contact for each school. So they've provided this number is for charters and private schools, independent, like just those schools can call, but they're asking one representative only. So we will also get you this form so you can have it handy in your offices. Okay, and then this is for the communication to like your entire student body, just saying there's multiple letters that were drafted by Colin, and we would just ask that just administrators send these out. We do not want nurses to complete these without administrators. But they just notify the families, you know, that there was either an exposure, that your student wasn't exposed, but just keeps families informed, because we know our families want to be informed and know what's going on our campuses. Yes. Okay, and then when you do have a student return, this can be the form that they take back to class with them to notify the teacher that they have met all the criteria and they're safe to return to school. You know, so it can be completed by the FASA or the nurse, and then they use that as their ticket into the classroom. And then to bring it all together, because we know it's a lot of information and it could be very confusing, what we're really encouraging is that each school put together a response team. And what this form does is puts together, I see some of the spacing is a little off, we'll fix that. But what it does is put together your team and how you're going to communicate and just the different issues you need to look at as a school. You know, we want everybody that's part of this team to be on the same page, so that we don't have one student that maybe notified an office manager, but that information didn't get to the nurse and admin, and so then the right people weren't, you know, the communication was broken and failed, so we still had that student on campus, you know, or so we want to look at having a team that communicates well and keeps all this information and data together, just because we know a lot of times we see where we fell is all boils down to communication. So this just really looks at who's going to do what actions and making sure the team communicates. All right. So if you need any help with any of this information, this is Tony's information specifically, Donna, and then my information. And then once again, there's the health district number. So I didn't know if we want to open it up to questions. You want to come back up here? I'm going to call Donna back in. And Tony. So we'll open it up to all of your questions.
Wanted, if you can hear me, I think you can. We wanted to let you know that the plan for the communication plan for a team on your campus is a suggestion. You can amend that any way you want, but it's important to know who's doing what on your campuses as far as maintaining records. I recently talked to one assistant principal who was calling me about something, and he didn't know about a log, that we need to log these cases in so that we can keep track on how long that staff or the students need to be out, was their contract tracing. So, and we're doing all of this, it's just not being documented. And so if one person was in charge and then they were out of work for some reason, not available, then the rest of the team or the school wouldn't know what's going on. The health district, Dr. Kingsley did say that the point of contact he prefers it is for it to be the administrator of the school, which is understandable. But if the administrator is not at work that day, it just seems to me there needs to be a backup person, whether it's an AP, whatever your choice is. But we could help you with that. The other thing Becky and I wanted to suggest to you is if you feel you're not sure where that second isolation area can be, we'd be happy to come to your campus, look at the layout, make suggestions for you, or help you identify a second person who can deliver first aid and medications, diabetic care in the classroom, rather than have students come down to the health office and have a possible exposure. So these are just options for you, and we wanted you to see all of the forms that are available so you know that we have a form for that. Any questions?
Yeah,
So,
so were these forms you sent out last month, or have they been revised?
they have been revised.
And then from the chat box, is it recommended for chemistry due to it not being accurate? Question mark.
Yes, basically that is true. And it also came from Dr. Fauci, the CDC, and from our health district. But I understand where they're coming from, but I do think it's another level of looking at ourselves and being cautious. It just reminds you to be cautious. That's my own opinion.
And then it was also asked,
Donna, can you repeat the questions because we can't hear?
Can you hear Tony? He's repeating them.
No, you. But so repeat the questions that you've been talking about.
so when I read the questions, you're not hearing me?
Can't hear Tony.
We can't hear Tony.
Oh, okay. No, go ahead.
Well, Tony's got a booming voice. Well, you've got to read it. Okay. All right. Okay. The CDC today is, okay, but up here, it's not recommended for temp. Yes, we were talking about that. The
So
CDC,
if you read this question out loud, you can't hear it. So
really? Well, let's do this one. The CDC today is
that's
releasing.
not a question.
Okay. Oh, really? That's from Nancy? Okay. Okay, today it says, is this for staff as well as, I'm assuming? Yes, it is. And so we were talking to nurses and administrators today because they'd be working as a team as we move forward in this pandemic. But the letters, all of the forms were placed in SharePoint for all of the nurses. If your administrator needs a form, there's a copy there, and you will be using the triage forms. You'll be using the form that you're going to send home with a student who has symptoms. It includes on the other side of it, or a second form, that the parent has to fill it out for the student to come back. Some schools want a proof of a negative test. The Southern Nevada Health District has said that you can accept a note from a physician, a letter from a physician, or a test. We can always be more strict in our schools, more cautious, but we can't be more lax, if that makes sense. And where are these forms you sent out last month, or have they been? They've been revised and they're in SharePoint. We put a folder in SharePoint called COVID. You'll find all the forms in there. The only ones that are missing right now are the ones that were developed, the letters from legal here at Academica, but they have been collated and they're going to be put in there. But again, we would not use one of those letters ever. It does ask for an administrator signature, and they have to sign that. So do nurses have access to the forms? Yes, but not FASAs. We can look at that down the road, especially the forms like for triage. I really like that form because it gives the nurse and the FASA or the backup in the health office a list of symptoms they should be looking for. You're not going to remember 20 symptoms every time a student comes in. So it gives you that documentation. And what was the question you answered as your opinion? Oh, the temperature taking, I think, allows the school to show that they're being very cautious. I know that for one charter that there was a person on their board of directors that was adamant about temperature taking. But I know for me, taking my temperature and my temperature is taken when I go into school, I just think it reminds us to be cautious. That was my point.
Donna, could you just, I know you probably said it once, but repeat. We may all go back to campus. We don't know, eventually hybrid or something. But, or if the people who are on campus right now, if there's a COVID, someone who's been on campus, they test positive for COVID, what is the process that the administrator has to do in regards to notifying, finding out what that person or anyone they've been in contact has to do, and all the contact tracing?
They have to do that. Where has that individual been on campus? Who have they been around? And what we mean by close contact is, 15 minutes within 6 feet of the individual. That's considered close contact. Our schools are actually going to be doing the contact tracing for the health district, the contact tracing on campus. So we would have to include all that information. Also, Dr. Kingsley said in a classroom, if one student has COVID, the whole class is going out. They're not looking at 3 feet or 6 feet. It's because of the sharing of the ventilation in the room over a period of time.
Can I add to this as well? I don't know.
Also, one thing that they said is that's why if you have a self-contained middle school class, what's hard is when you go back, if teachers are going in and out and one teacher becomes ill, every class they've gone into has to go out.
Nancy and Donna. Nancy and Donna. This is Bridget, and I think, Donna, you referred to this because Dr. Kingsley did say that if you had, for instance, 4 teachers working in a classroom and they were working, even if they had masks on and were 6 feet, that they still needed, if they were in direct contact, to be quarantined. But that makes sense. It's because of the ventilation is what you're referring to, Donna.
That's right.
Okay,
You're absolutely right.
Okay.
What I was going to add to this is that what the health district actually stated too about contact tracing is that they will wait until they have a positive. So it's really important that if you have students or staff that present with symptoms, that you're getting them to get tested right away, because you have that window where the health district is going to begin contact tracing at the time of a positive test. So that's just where it comes into the point of get those parents on board to go get testing or go get the staff tested right away, so we don't have it blow up into this bigger issue.
Yeah, that was a good point, Becky. And as far as when do you notify the health district, we're not notifying them with every symptom that we see. We're notifying them with positive tests, or you can notify them if you have a staff member or a student with a myriad of tests, of symptoms. But basically, they want just to be notified of the positive test, who that person is, who they were in contact with. So you could see that for like a middle school student who goes to different classes, Dr. Kingsley said all those students would go home for each one of those classes. So that would be a lot of students for us. It would be about 60 students or more for the duration if we had a positive case in middle school. One of the principals told me that what they're doing on her campus is that they want to keep the administrators working so that they only go in a room for no more than 10 minutes. So they're under that 15-minute time. And I thought that was clever.
All right, so someone is red, so they can't be. So then, therefore, masks not effective, and then so.
Well, they're not saying that masks aren't effective. What they're saying is that that can decrease the spread of it, but they're going to further decrease the spread by quarantining those students. So it can decrease it by mitigating, those factors of wearing the mask. But yeah, if there is an exposure, they will still send all of those students home to quarantine.
And speaking of masks, I have seen on the campuses masks with valves. And that does not, the person wearing a mask with a valve, they're protected from me because I'm wearing a regular mask, but I'm not protected from them because it's a one-way valve. When they breathe out, their pulmonary droplets are going out into the air. So if you see that, I know one of our nurses did bring it up to a teacher, and she felt very uncomfortable doing that, but she did the right thing. And I'm sure the teacher appreciated it. And you have to understand too, from the public's point of view, why are they selling these masks? Why are they so available? All different colors and styles with a valve. And that's a ruling by the CDC, and it's also in our county plan as well.
Right.
And the other thing is shields. I saw 2 students at one of the schools. They came in for health assessments, no mask, but had a shield on. A shield is ineffective in protecting others. So you have to put a mask on that child. And again, I think the parents just don't know.
Donna?
Go ahead.
Donna, does the health district tell the school how long they have to be out for if there is a positive test? Who
Yes,
has to be out and for how long?
They do. So if they have a positive test, they're going to be out 10 days from the date of the test, and they have to be fever-free for 24 hours before coming back. But if you're exposed, then it's longer, it's 14 days, because COVID has an incubation period of 2 to 14 days. So you may not be sick that first 10 days, but you can still come down with the virus the last 4. The virus didn't replicate fast enough.
Yeah, but
Let me see.
right here.
When you were speaking earlier about students returning to school and needing a negative test or a doctor's note, is that only if they tested positive or had a general symptoms? General symptoms. And so the health district would like parents to get a test because that's how they can look at incidents of COVID in our community. But if the policy from the health district does allow for the student or the staff member to be out the 10 days from the first symptom, or to be out and fever-free for 24 hours, or to be out 14 days with an exposure. 10 days with a positive test. Some schools, you can ask for a negative test when they come back. In fact, on that one form, when they come back, it says 2 negative tests. And the reason it does that is that you can get some false negatives. You're not likely to get a false negative on 2 tests. If they are positive, don't they? Yes. But we can also, for Southern Nevada,
Read that question.
okay, it says if they are positive, don't they need a negative test to come back? The Southern Nevada Health District says a doctor's letter is acceptable. If the school wants to require that, they can. You remember, you can be more strict, but you can't be more lax. Yeah. You don't, yeah. Can they return with a parent note, or does it has to be a doctor's note? But that one questionnaire, it's an attestation where the parent is saying, yes, I did this, I did this, I did this. But we want to see the note. We want to see the negative test if one was done.
They have to have a doctor's note if they're going to return before that 10 to 14 day period. Like there's, and you can look in the forms and you'll see there's really strict criteria of like, if you've had a fever in the last 24 hours, you cannot return. It's really broken down simply, but say they decide, you know what, my kid had symptoms, they had a fever, they were in the health office, but then they go to the doctor and the doctor says, your child has a UTI. We know it's not COVID. The doctor can write a note and that student could return to school with that note. But we have to have very specific symptoms and why the doctor wrote the note and why they're returning. If the doctor just writes, they can return to school, they can't return to school. They have to either have a COVID negative test or documentation saying why they had their symptoms and why it's not COVID.
Otherwise, they're out that duration of time.
Yeah, otherwise they're out the entire time. But it's really broken down, and I don't know if you want to go through that more thoroughly.
There's three choices on here. The parent's going to check all the boxes under the choices. So if your child is exposed to someone with COVID but did not have symptoms, all the following boxes must be checked. So it's been 14 days has passed since last contact with a person with COVID-19 and no symptoms developed. So they check both those. The next choice is if your child was diagnosed with COVID-19 and did not have symptoms, all boxes must be checked. Again, 10 days have passed since the first positive COVID test and no symptoms have developed. And it also has, if your child was tested to determine if they still had COVID, they must have 2 negative COVID-19 tests in a row, at least 24 hours apart. And lastly, if your child had at least one symptom of COVID, fever of 100 or higher, chills, cough, difficulty breathing, you know all of the symptoms. It's been at least 10 days have passed since the symptoms first appeared, and 24 hours have passed since the resolution of the fever without medications and improvement in symptoms. But if your child was tested to determine if they had COVID-19, they must receive how many? Still 2 negative COVID tests in a row, at least 24 hours apart. Fever has resolved without medication, and respiratory symptoms have improved. Is that a different one? Okay, Tony's on top of it. Oh, there's a 4th one now. Yeah. Okay, we added this one. Oh, yeah. If your child has COVID symptoms, but has seen a healthcare provider and has been diagnosed with a non-COVID related illness, all boxes must be checked. And we talked about this too. It's been at least 24 hours have passed since resolution of fever without medications, and an official letter from a medical healthcare provider that defines the known health condition and exact symptoms exhibited. So we can add that to Infinite Campus as what do you want to call it? A notation for future incidents of whether it's an allergy, whatever. Does that make sense? It's a lot, isn't it? But it's giving you 4 different scenarios why that student was excluded and what they need to do, 4 different ones, what they need to do when they come back. They don't have to do all of them, just the one that pertains to them.
So, sorry, basically, if a student is sick now with symptoms, they can't come back to school if they report those symptoms unless they at least have a doctor's note saying they're okay to return. So there's no more students not going to the doctor when they're sick, basically.
Well,
Yeah, they can. We're always going to recommend it. Is it mandated they have to? No. I know it's kind of counterintuitive, isn't it?
I thought that's why, because I was the one that typed in the question about, is it only if they test positive, or is it if they just have symptoms? Are they required to have a doctor's note to return? And I thought, I just want to make sure, because I know our principal is going to ask for clarification. So
That's a good point. No, if they had symptoms and they stayed out the 10 days from their first symptom, they don't have to go to the doctor.
But they have to stay out for 10 days.
Right.
Okay.
We can't require them to go to the physician. We can't even require the testing, but we strongly encourage it, but they still have to wait that time criteria.
Okay.
So someone asked about attendance, okay? I can see we're going to have a combination of always having distance ed, even when we go back hybrid. So the student has to go right into a distance ed classroom setting for them to be counted for attendance.
Exactly. And that's in that one letter, when we go over the symptoms with the parent, that's in that narrative. But that's going to be offered to all the schools, is that, yes, that they would go right into online learning, and they can come back to the classroom once they have done their time, so to speak.
Yeah, we really do foresee students coming in and out a lot, with the criteria we have, whether they have symptoms themselves.
So Jeannie had put a question in. If the student is sent home with an illness and they don't attend distance ed or virtual learning, I am pretty sure that is going to count against their attendance.
Yes. Well, yes.
Okay. There's no attendance code for COVID.
No.
So that's why we have to get them. It's only, I think, 1 session a week that they have to sign in for attendance counting. We want them to do more, but some kids are home. If they're obviously too ill, they may not be able to
I think that's the minimum they can sign in.
Right.
Yes, you're right. I know that some, like one particular high school I was at, they're sign in every period. Are they in that class every period?
Right.
Yeah.
Yeah, schools had the option to choose what attendance policy they were utilizing.
Yeah. So, which is really very similar to what is if the child was there, the student was there on campus. They're keeping attendance, that particular school, as if the student's on campus, using the same mechanism. And the student I was looking at was missing a lot. All of first period. So typical of teenagers, huh?
Is it all the same guidelines for staff if staff are sick?
Yeah. So the 10 days, the 14 days, fever free, it's all the same. So you don't have to memorize all of those. But if you use those flow charts, it's going to make it very clear, and it doesn't take long to internalize all of that. One of the things I've seen, I think Becky has seen it too, and probably Tony, is that a person is exposed to somebody who has COVID or has COVID symptoms. They go and get tested the next day and they think they're fine. What is wrong with that picture? It hasn't been 14 days, has it? And it's only been the next day or the next 2 days. So the virus it's 2 to 14 days is your incubation period. So chances are, if they were going to get sick, that not enough virus has replicated yet to give them a positive test. And then they're out there in the community going here and there thinking they're fine, then they become sick. So.
Do staff have to have a doctor's note to return if they have tested positive?
I think the schools are, the ones I've known are requiring a test, a negative test.
Negative test.
Following the guidelines and still doing a negative test at the end of their quarantine or isolation. Anything else?
Real quick, Donna, if a kiddo, because we all know like strep season's coming soon. If we're back on campus, we're gonna have like 500 kinders with strep. If the doc says it's strep, but they did not perform a COVID test, do we have to assume? Do they still need to stay home with COVID precautions because it wasn't necessarily ruled out? Because not every doctor's office has capability of testing for COVID.
No, but usually they have the rapid strep test.
No, correct. But I'm saying they might have strep, but can we really say it's not COVID?
If the doctor writes that it is, yeah, according to the way the policy for Southern Nevada Health District, we can.
They need to rule out that they don't believe it is COVID. The doctor has got to.
Can't hear you.
This computer only picks up
I was like,
right in front of it. So we have to like shuffle back and forth.
6 feet away.
Sorry. But what I was saying was they've said that, now I've lost my train of thought altogether. Oh yeah, that it has to be specifically that they're ruling out COVID. You know, that what they're looking doesn't have the same symptoms.
correct.
Be both COVID and strep.
But could
So
it
that's
be-
basically, and what the health district believes is that very few doctors are going to be willing to sign these
correct. Yeah.
and say that it's not COVID without a test being done. Because
Absolutely.
they don't want to take that liability of there being an outbreak in the school and them signing off on it either.
That was my thought, but there are some shady practitioners. So
Yeah, but they did allow for us to accept that, but it has to be specific symptoms and why they believe it's not COVID.
Okay.
And we're worried about the
You
masks.
have to be in front.
Yeah, we're worried about the masks. I mentioned it earlier, is that we're going to get these letters from doctors, nurse practitioners. That's for Hillary. Saying that, the student doesn't need to wear a mask.